to another edition of the EasyConnectMD.com video podcast. Gabe Farias and Dr. Daniel H. Kellum Jr. Dr. Kellum, thank you so very much for taking the time to talk about health and wellness in the South Texas area. Of course, you are the CEO of Kellum Physician Partners, a great partnership with EasyConnectMD.com. It is a sponsor of this podcast. 3 easy steps. Seeing a provider hasn't been easier. You can log into EasyConnectMD.com, fill out some information, see a provider, get better, and Dr. Kellum, within 15 minutes, those 3 steps, you're on your way to go check out and get your prescription.
Yeah, Gabe, it's really very easy for people to, if they're feeling bad, if they're experiencing some things out in the environment, allergies, irritations, that sort of thing right now, or if they just simply have questions, it's a super simple way to get in front of a provider and ask some questions that are really probably plaguing people right now. It's a very, very unique platform that I think is really the way of the future in terms of medicine.
Yeah, and if you think about why people use telemedicine, you think it's you have a medical problem. A lot of times people are using this for information purposes.
Sure.
And there isn't a greater time really since the beginning of telemedicine to use it as an information platform than now with COVID-19, with everything that's happening from a health and wellness standpoint. And people use this platform to ask questions. Absolutely,
and especially now with the rollout of the vaccine in the state, there's a lot of people with a lot of hesitancy and a lot of questions, and EasyConnect MD is a wonderful way to get in front of people that understand what's happening, understand the vaccines, understand what's going on in terms of outcomes with that, and can put people's mind at ease if they have some reticence towards that.
Let's talk about the vaccines because they've been rolled out. We've had a small allocation, although the state of Texas is doing the absolute best that it can to get the vaccines out to make sure that people have both the first and second dose. It's been a little less than fluid, but medical providers are doing a fantastic job of not only getting it, distributing it, making sure that the people that the government has designated in the different phases get it. Right now, I believe we're in 1B of the disbursement.
Yeah, and it has been a little bit less than fluid, I will tell you. Although, in saying that, I think everybody's doing the best that they could.
Absolutely,
this is something that we have not experienced before. The state is doing the best that they can to try to allocate it to the partners, whether it be the public health departments or whether it be private practitioners, in order to help facilitate this vaccine to the community. We have been lucky enough recently to get a 200 dose allotment, which was really meant for phase 1A, which was all of the frontline workers, healthcare workers, and we've done, I think, a very good job in trying to reach out to
We've done an excellent job of not only giving that out to those folks, but reaching out to the community. I know you're not a big backslapper of yourself, but I will tell you, you are truly a community first guy. And the first call we made was to the city of Schertz to say, what do you need? How can we help you?
It was, and it was wonderful being able to work with Mr. Long there at the city of Schertz, as well as the mayor, in order to make sure that we could pool our resources, because alone it would be difficult to create enough penetration within the market to be able to create the immunity that we need. But as a unit, as a community, I thought we could do a much better job, and it was really kudos to them for helping to coordinate that, but reaching out to them so that we could get every healthcare provider that was within the community of Guadalupe County that we could reach, so that we could begin to finish that and then move into 1B, which is super important because that's really where we begin to hit other high-risk individuals in the community at large. And, for us, this is the time not to be an individual practice. This is the time when we have to truly be community liaisons. And that's what our attempt was. That's what the city of Schertz helped us do. And I think with all of us together, we did a really good job in getting to that point, and now we're ready to kind of move forward with that.
And as the state governments were determining who were getting the vaccines, we were, I guess, in essence, on the phase 2 list of those that got the Moderna vaccine initially. But we had a phase 1 partner who really, really stepped up and helped our staff, because at the end of the day, we're the ones that are helping those folks. And that's why the government says, you know what, we need to take care of our medical folks, because if they're healthy, that means those folks can help others get healthy. Talk about the partner that really stepped up for us in our first phase vaccine.
So it was the initial allocation after the emergency drug use was approved by the FDA, it was really a little bit of a question on how we get it, the process that we get it. It really wasn't well defined. Happened to get a South Texas Allergy and Immunology, which is a allergy and immunology group within San Antonio, and they reached out to us and did a very good job in terms of getting our practitioners there, allowing our staff to get immunized, which honestly did a really great job in helping the County of Guadalupe, incidentally, because it freed up our vaccines when we got them to be able to administer them to the first responders and healthcare workers within our county, and then kind of bleed into the beginnings of Phase 1B. Unfortunately, we have run through our initial allocation and waiting for more to come to the state, but that is a great example of how community helping community really bleeds to help every individual, whether it's Bexar County or whether it's Guadalupe County or whether it's Tri-County area as a whole. And again, thank God to South Texas Allergy and Immunology and quite frankly, the city of Church to truly focus on our community to try to get them vaccinated as quickly as possible.
And I want to ask you one question, because a lot of times we're still getting folks that say, I don't know if I want it, I don't trust it. My premise whenever I do something like this medically is I ask you. There's nobody in the world, in the country, that I trust medically than you. You've been my provider. You've been my father's, my mother's, my entire family's provider. And you said, Gabe, I would give it to my kids. If I had an opportunity to give it to my children, I trust it. And I think trust is a big factor in this. You trust this vaccine.
I do trust this vaccine. I really, really do. And the data actually is supporting my anecdotal belief that this vaccine is very safe. I received my vaccine, about to receive our second dose. Our staff has received their vaccine. And really, we had very limited issues associated with that. And really, when you look at the data as a whole, the CDC has done a good job in giving us information with that. And there's something called the Vaccine Adverse Reporting System, and it's a self-reporting system, and everybody that gets vaccinated will get information to how you call if you have an experience or you're having a side effect, and help us report so that we can gather data as a whole. And for the first 6.68 million doses that were out there was 3,000 adverse reactions, which when you look at, seems like a lot, but when you look at percentage, it was 0.0004%. So super small amount of adverse reactions. And in those, the most common were sore arms, which all of us experience for a day or two, nothing major. Nausea and headaches were the biggest things that we see. The biggest worry that I've heard from our patient population is allergic reaction and anaphylaxis, and that's a concern certainly that it's there. As of January 6th, the CDC came out a report, and it showed that there was 21 cases in the first 1.9 million doses of an allergic type reaction, and that can be anywhere from a little bit of swelling to a rash to needing a little bit more intervention with oxygen, things like that. And that percentage is 0.00001%.
Yeah.
And so it gets beyond what I can do with math because I don't have that many fingers, but what I do know is that it's a very, very low percentage. And in that allergic reaction, 71% of the time that it happened within the first 15 minutes. And that's what we're doing when we vaccinate people. We get them in, we give them the shot, we observe them for 15 to 20 minutes, we make sure nothing is happening, and then we send them on their way. And we're fully prepared once we vaccinate individuals, if there is some sort of allergic reaction, that we'll be able to handle it without any kind of issue. And so the numbers are interesting because I think it should give people a sense of reassurance over time. And what I think you're going to find actually with that is that as we continue to vaccinate more and more and more individuals, that percentage of adverse reaction will go down even more, if conceivably possible, as low as it is right now. And so I think what we're starting to see is really the evidence that this vaccine is very safe, both the Pfizer and the Moderna, and well tolerated. And ultimately, we all know the efficacy is fantastic. And so, I think everyone should have some reassurance with that. For those individuals that wanted to wait because they wanted to kind of see, I think the data is rolling in for them to understand that it's going to be okay. And at the end of the day, we will have protection and immunity against such a horrible pandemic, and be able to hopefully get along with our lives. But more importantly, not lose any more people that are really close to all of us.
All right, we're going to take a break here in a second, but before we do, because I want to talk about cedar fever in our next segment and how that can kind of confuse people on getting, false indications of what they think is. We're going to take a break here in a second, but I want to talk to you right quick or ask one more question because one of the concerns is, well, this technology is new. The way that they're doing it has never been done. That's not true. They've been working on this technology for a while.
They have working on it for the better part of 10 years. And what they were doing is they were creating a technology platform that basically set the stage for this messenger RNA technology in terms of vaccine. And what happened with this SARS-2 virus, this Corona-19 virus, is that they were able to take the genetic components of that, understand what that was, and then create this messenger RNA vaccine. And what it does is
It's not a live virus they're putting inside of you.
So it's a little bit of genetic information that goes into the cells. That genetic information is super unstable, and why that is a benefit for people, not a negative, is that it gets into our cells and then it goes away. So it's not anything that's embedded. It changes our DNA or anything of that nature. But what it does is it signals our cells to produce a protein. That protein is very similar to the spike protein that sits on the capsulation of the coronavirus, and that protein is what our body produces immunity to. So then if you get the coronavirus, any kind of exposure to it, our body recognizes those proteins and they're able to produce antibodies that help protect us with that. And in that, what I will say, what people are worried about are these different strains of coronaviruses that are coming out. That encapsulation, that protein stays the same within these different strains as we see that right now. And so we're hearing about all this different kind of stuff that's happening, but rest assured, as we know now in science, is that our vaccines will help protect us from the different strains of these coronaviruses as it is today. And my own personal theory with that is that as we tend to turn the tide in terms of vaccines, in terms of the exposure with vaccine and the contagion with this vaccine, there will be less people getting it, less people spreading it. And my hope with that is that these different strains tend to fall to the wayside and it becomes less of an issue for us. But as it stands right now, we know coverage is good, efficacy is good, safety is good. It's just allocation and availability.
Yeah.
And that's something that the state and the federal government, I think, are working very diligently for.
Okay, cedar fever is just running rampant right now. The levels are through the roof. We're going to take a quick break. When we come back, we're going to quickly touch on that. False indications on folks that think they have it but probably don't. And the way to do it is through Easy Connect MD. If you want to talk to somebody, $39.95, 3 steps. You visit easyconnectmd.com. You fill out some basic information. Step 1, step 2, you see a provider, get better. Step 3, you're on your way. If there is a need for it, to get a prescription at your local pharmacy. We're going to take a break, Dr. Kellum. When we come back, we'll be talking about cedar fever and some of those effects that it's having on folks.
I'll be here.
All right, folks, hang tight.
Yeah. Hello, I'm Dr. Daniel Kellum, CEO of Kellum Family Medicine in Schertz, Texas. For the last 10 years, we have been proud to serve your family practice needs in the growing Tri-County area, and I am proud to say today we are growing with you. We are about to embark on our new state-of-the-art 22,000 square foot medical office building as part of our continued commitment to this community's growing medical needs. If you would like to become a patient at Kellum Family Medicine, please visit kellumpatient.com. Thank you, and please stay healthy and safe. Hello, my name is Dr. Daniel Kellum, and I'm proud to introduce you to easyconnectmd.com, powered by Kellum Family Medicine.
If your goal is to make life less hectic, then easyconnectmd.com is for you. For those non-emergency ailments, log on to easyconnectmd.com and see a licensed medical professional from your home or office. With easyconnectmd.com, there's no need to miss work or school or spend hours at a minor emergency clinic. Get medical care online and on time at easyconnectmd.com.
Okay, welcome back to the second segment of today's easyconnectmd.com video podcast minute. Remember, easyconnectmd.com. Seeing a provider couldn't be easier. 3 steps. Step 1, visit easyconnectmd.com. Fill out the information they ask you. Step 2, see a provider and get well. Step 3, you are on your way 15 minutes, 20 minutes, 30 minutes to go get a prescription. It is incredibly easy, only $39.95. And Dr. Kellum, these telemedicine services are so vital right now.
Absolutely.
To get information. Yes, they're there in case you have a sinus infection or in case you have any type of acute ailment or you have any questions, but questions on things like cedar fever. Right now, cedar fever is running rampant. Talk about first what cedar fever is and how it can give folks a false indication that they could potentially have COVID-19.
Well, so for anybody that's lived in this community for any length of time, we all know that this time of year, Mountain Cedar tends to be elevated, and a lot of people within our community have some sensitivity to Mountain Cedar. What happens with that, as everybody knows, is that you get congestion, cough, sinus pressure, runny nose, sometimes a little low-grade fever, but mostly not. But the problem is that all of those symptoms very much can be conflated with COVID-19 symptoms. And any place that you go, any doctor's office that you go to, what they are doing, and rightly so, is screening everybody for COVID-19. And so it's a little bit frustrating for some patients, I will tell you, and understandably so, but in the bigger picture of what's happening, it's a necessity. But you're going to go into a doctor's office, they're going to do a COVID-19 swab. You may or may not want that. It's going to be a little bit of a hassle. You're probably going to ultimately not have COVID-19 if you've experienced these same types of symptoms forever. And I think that the very easy way to bypass that is through easyconnectmd.com. You get on, you explain your symptoms. All of our providers are well-versed in many areas of medicine, but certainly have dealt with this for years. And it's a good way, if this is something that you've had an issue with and you know you have an issue with every year and you can talk to them, you can have access to good quality care with good medication and resolution of this issue without having to expose yourself to a lot of individuals that may have had COVID-19, but also to the little bit of the difficulty and process now that it would take to get in front of a provider and see them, because every place you go, is our clinic included, we are uber sensitive to making sure that we're screening people, keeping ourselves safe so that patients remain safe, staff remain safe, and this is one of the obstacles for people that have Cedar issues right now. And so easyconnectmd.com, $39.95, a very easy way to get around all of that, get what you needed, get it taken care of quickly from the convenience of your home, get a prescription, you can pick it up within probably an hour, get yourself started on medication.
Super convenient.
Super convenient.
And the thing about that, because most folks like myself, if I'm worried, I've got the sniffles, I feel feverish, I feel congested, you're going to come on and you're going to say, Gabe, have you had Cedar? People are going to know whether this affects them. It's not going to be something new to them. They're going to say, yeah, every year in South Texas, it kicks my butt. Okay, that's the first thing. Number two, who have you been around? Have you been exposed? Do you know anybody? So simple questions, but the information is what will, two things, put individuals at ease and also give them the correct direction. Well, I went to a Christmas party a few weeks ago, and yeah, somebody came out positive. Go get checked. You're going to get that information when you visit telemedicine platforms like easyconnectmd.com.
Absolutely, that is true. And that is where I think the benefit for people that have had experience having Cedar issues in the past, really to sort of parse through all of this, let the provider know that you get on easyconnectmd.com, and they'll be able to really ascertain that. What's really important, though, too, is for people that don't usually get Cedar fever issues, or Cedar issues, I should say. If they're starting to have those kind of symptoms, talk with a provider, because it doesn't mean that you can't have a multitude of other things that commonly plague people during this time of year. And not everything is COVID, but unfortunately, a lot of it tends to cross over in terms of symptomatology. And so to have an expert in these areas that you can get to from your home without exposure at a very low cost is a very simple way to try to get through the noise, stop having to go through the hassle of the process, although important process, I'm not diminishing that, but to achieve the end, to achieve a better outcome and feel better within a short period of time so that we can move on to our lives, we can keep you from being sick so that when the vaccine is available for you, you can feel comfortable getting it without any associated other issues, and then get to the place that we're all doing better from a community standpoint.
All right. Okay, so I've got one outside-the-box question I'm going to ask you right now. Everybody knows I'm a sports guy, right?
Right.
Most people do. I mean, if you watch television and watch high school football, you can say, hey, that's that goofy fat guy from the sidelines from that high school football stuff, right? You would think?
You would think.
Is Texas basketball really that good? I don't mean to kind of vary off, but I know you're a former college basketball player. I see the Texas Longhorns as one of the best teams in the country. Is this for real, or is this fool's gold?
I think it's for real.
Really?
Actually, looking at them this year, and I'm a fan of the Longhorns, but certainly a fan of basketball.
Yeah.
This year they look tough. They look like they're dominating most games.
So Shaka's got it going on.
Seems to.
Okay.
Thank the Lord.
All right. Thank you very much. I just had to throw that. I guess kind of the inner sports guy just kind of came out there. EasyConnectMD.com. Don't visit that if you're feeling bad because the Cowboys are not in the playoffs. But if you're feeling...
But if you can, because anxiety and depression is one of the things we certainly can't treat. And being a Cowboys fan for many years, I can totally understand what you're feeling.
Oh, God. I'm so Sick to my stomach. Anyways, Spurs look pretty good this year, though.
Happy for them, too. They're coming.
Folks, EasyConnectMD.com. Super, super easy. Step 1, visit EasyConnectMD.com. Fill out some information. Step 2, see a provider. Get well. Step 3, 15 minutes, you're on your way to a pharmacy to pick up a prescription if it's called for. Only $39.95. Dr. Kellum, as always, thank you for the information. And folks, please be safe out in the community.
Take care.